Joining me now on the line is Senator Bill Cassidy of Louisiana. Senator, thanks for joining me on Breitbart News Sunday.
Yeah, I'm glad to be with you. Thanks for having me.
So we just wrapped up an hour-long discussion of tomorrow's embassy move in Israel, and I just want to first get your thoughts. Talk to me about the significance of this.
Well, a couple things. One, it's significant that President Trump campaigned on it, promised to do it, and he did it. People seem surprised that he kept the campaign promise, but I think it's kind of the measure of Trump that if he tells you he's going to do something, he's going to do his darndest to get it done. Obviously, it means a heck of a lot to folks in the United States as well as the folks in Israel. So it's quite a momentous decision.
No, absolutely. And we just wrapped it up, so I just wanted to get your quick thoughts. But now let's talk about what I actually brought you on this show to talk about, healthcare, specifically the cost of drugs and transparency of prices. The White House rolled out on Friday a plan to bring down drug costs. You were there in the Rose Garden with the president as a doctor, as a senator. Walk me through what Trump's plan means for Americans.
Well, it should mean lower drug costs in the near term, in the intermediate, and in the long term. In different ways, it should continue to lower costs as things are implemented. It does it by restoring market forces. Right now, the patient, everybody but the patient has a law protecting their interests. And folks abuse the market, if you will, legally, but it's still done in a form of abuse that allows them to get more money at the expense of the patient and of the taxpayer. I think the president says there's 50 different ways they attempt to go at this. So hopefully all 50 will lower costs for patients.
No, absolutely. And I mean, can you just explain that a little bit more? I think what you're trying to say is by trying to say, I mean, you are saying, but I'm trying to understand, is that it's almost like there's middlemen that are getting rebates versus the actual people getting, I guess, discounted rates. Because, I mean, Trump kept mentioning, we want to stop these middlemen, right, with the rebates. And I wasn't sure what that really meant. And I was hoping that you could walk me through that.
So the drug manufacturer will negotiate a deal with a middleman called the Pharmacy Benefit Manager, or the PBM.
That's the term he kept saying, and I was very confused by that.
So say the drug costs $1,000, and they negotiate a 50% discount. Actually, they're going to sell it to the pharmaceutical company for $1,000. Excuse me, to the middleman for $1,000, but they later rebate to the middleman $500. So the net cost is $500. The insurance company, not the middleman, but say the Blue Cross or the Aetna or the United, gets the drug for $500. The patient, who has a deductible and a copay, she oftentimes pays the full list price.
Mm.
She doesn't get the $500 rate. She gets the $1,000 rate. And the middleman will take the $500 extra that the patient paid and put it in their pocket.
Got it. That makes more sense. That makes a lot more sense than what I was trying to explain to myself. So one thing, though, that critics have pointed out is that Trump's plan doesn't include his campaign pledge to use the buying power of Medicare and the Medicare program to directly negotiate lower prices.
So these same middlemen, the pharmacy benefit managers, they actually, nobody's evil, but they're just bad incentives, and people are responding to these bad incentives. So one thing he does is he goes to the middlemen and says, right now, you're only negotiating on some drugs, but not all drugs. We want you to negotiate on all drugs. Now, actually, he's expanding the number of drugs that the middlemen are negotiating for. That's a good thing, as long as the middlemen pass the savings back on to the patients or to the taxpayers. So he is expanding the number of drugs for which there's negotiations, and at the same time, he's making sure that patients benefit from it, that the negotiations just don't benefit the middleman, if you will.
Gotcha. Now, on a different but closely related topic, you yourself have been spearheading a bipartisan effort to launch a healthcare price transparency initiative. What's this about? What's the goal there?
Could you imagine that if you go and get a blood test, your doctor orders a blood test, you know the cost of it beforehand as opposed to getting the bill 6 months later? And you kind of go, whoa, I didn't know it would cost this much.
That would be amazing. That would be amazing to know ahead, up ahead. Yeah.
You would never buy blue jeans or a car or anything else unless you knew the price beforehand. So what the president's trying to do and what we're trying to do is allow the patient to know the cost before they make the purchase as opposed to later, and to be able to so-called comparative shop. So, hey, listen, recently there was something where the same medicine would cost $44 in one pharmacy and $700 in another pharmacy. That was the difference. Wouldn't it be great if the patient knew that? Of course, she would go where it costs $44. Right now, since she doesn't have a clue, she may end up at the place where it costs $700. That's wrong.
Yeah, no, and it does seem like pretty much in every other industry, customers are able to price shop. And I can go to an auto, lot and look at a car price here, and I can go down the street and look at another one, and I can compare, and that puts me in an advantage spot. Competition then thus drives lower prices and then improves quality. So this sounds very exciting. It looks like you've gotten a lot of feedback, though. I think I was reading like 1,000 responses from different players in the industry. What have you learned?
Well, if you're making money off the current system in some way, you can't see it changing. It's just amazing the way that works, right?
Yeah. Go ahead. Were you saying something?
So, one thing what we're doing, which dovetails with what the president's doing. I forget if it's 60 or if it's 80%. So say 60%. 60% of the time when someone goes to buy a medicine from the pharmacist, it would be cheaper for them to pay cash than to pay the deductible through their insurance policy. The patient doesn't know that. She pays her deductible and her copay, which is more than she would pay if she just said, okay, I don't want to use my insurance, I just want to pay cash. Now, that's the so-called gag clause. The pharmacist is not allowed by contract to tell the patient that it's cheaper to pay cash. It blows my mind. So if the pharmacist does tell the patient that it's cheaper to pay cash, the pharmacist loses their contract with the middleman, with the pharmacy benefit manager. Now, that's wrong. So, one, the president's trying to get rid of the gag clauses. They're called gag clauses. And we're trying to get rid of them through the price transparency. The patient should be able to log on. You mentioned going to one auto store and then going down to another. No, you're going to get on the Internet. You're going to get on the Internet without leaving the comfort of your kitchen table, your kitchen chair at your kitchen counter, and you're going to say it's $1,000 cheaper here. That's where I'm going. We need to make it so you can look on your smartphone and you can say, the medicine costs $44 there, $700 here. I'm going here. And by the way, if I pay cash instead of paying my deductible, I'm going to save $15. So that's the system we're trying to usher in.
I love that. That seems like a very admirable cause, and I could definitely benefit from that. So I wish you the best of luck. I want to ask you, though, I was just talking with Ted Cruz earlier in the day about this. It looks like you and him and some of your colleagues sent a letter to Majority Leader Mitch McConnell on Friday urging him to expedite floor proceedings before the end of the fiscal year, saying, we're willing to work Mondays, we're willing to work Fridays, nights, weekends, and we can even cancel the August recess. We just want to get things done. We want to get Trump's agenda accomplished. Is, in your opinion, Congress broken under its current leadership?
I think what's happened is the Democrats hate Trump so much that if Trump said turn the air conditioner on a hot summer's day, they would say no. And so they've done everything they could to slow things down, to the point that at this current rate, Trump will get all of his people nominated and in office 9 years into his term. So that's just the way the Democrats have played the game. By the way, that's not being partisan, my analysis. The Washington Post looked at it and agrees with that. So if it takes staying in extra in order to get these folks approved, because otherwise Democrats won't allow it to happen. Hey, let's stay in extra. We'll do it. Get it done.
Yeah, I'll be curious to see whether or not Mitch McConnell takes you guys up on that offer. But one of the things that I think you guys could probably benefit from would be getting something done about our opioid epidemic. This I know has been plaguing the country, as you know, and it looks like you recently just co-sponsored an opioid, bill earlier this month. Is there any chance that this is going to get passed?
Yeah, we've been working really hard on this issue in a variety of ways. And the Congress has already passed a couple of maybe 2 or 3 bills so far addressing the opioid epidemic, making federal resources available for states and for communities and community organizations to put in programs. We're also trying to decrease the supply. I think that'll actually happen. We're also trying to take, the cartels move about $110 billion a year from the United States to Mexico, $110 billion. So we're also trying to figure out how to stop that. Frankly, my idea is if we can stop that, confiscate that money, we can use cartel money to build the wall. It won't be the Mexican government, it'll be the Mexican cartels, and that's probably the better party to build them.
Yeah. And some even say the cartels run the government, so maybe it's all the same money. On the topic of cartels, immigration, and whatnot, later in the show, I'm going to be talking with somebody with a big news announcement about a lawsuit involving sanctuary cities. What can Congress be doing, Senator, to fix the problem that is sanctuary cities in our country?
So you got to enforce the law. And so if a community is not enforcing the law, then frankly, it shouldn't be up to a judge to say that the federal government cannot require the law to be enforced. And most public officials, if not all, in the United States, when they're sworn in, get sworn in to uphold the Constitution. I'm pleased that some of the California cities, California sought to become a sanctuary state. Some of the California cities have said, no, we're not going to become a sanctuary city, part of a sanctuary state. We were sworn in to uphold the Constitution. And so we want to uphold the Constitution. You wouldn't think it'd be controversial, but apparently it has become so. Congress can support the executive branch as it attempts to make sure that the Constitution is upheld, and that when Congress passes the law, that it be enforced, and that if a city not enforce it, there'll be consequences.
Yeah. Do you think that we should be holding mayors like Libby Schaaf in Oakland? She's the one, of course, that gave the heads up to the illegals before the ICE came in. Do you think that we should be holding her accountable? Should there be any sort of, should this be made illegal to do this?
If a city, it's already illegal. If a city clearly, in the sense that if Oakland is a sanctuary city,
right,
and not cooperating with ICE, the Immigration Enforcement Agency, then it's illegal. They should pay consequences. And I think the administration is one trying to implement such a program. As you might guess, the city can find a judge which says it's not valid. In some cases, the city is not a sanctuary city, even if the federal government alleges. There should be due process. So if the city is not a sanctuary city, it shouldn't be penalized. But on the other hand, if you have a mayor who's subverting the law, allowing people who are criminals to beat it out before they get arrested, and then in some cases those criminals go out and commit other crimes, there should be a consequence from a federal level, but ideally voters will vote them out. Most voters want safer streets, not less safe streets.
Yeah, absolutely. Again, folks, I'm talking to Senator Bill Cassidy from Louisiana. Senator, before I let you go, I just want to get your thoughts quickly on North Korea. Obviously, huge news last week with the bringing home of those hostages, people, are Americans over there. What do you think of this summit that may or may not be happening? Do you think that we're moving in the right direction with North Korea?
We are absolutely moving in the right direction. The release of the prisoners, the shutting down of their nuclear program, the better relations between North and South Korea. Clearly, we're moving in the right direction. Are there potential hurdles and stumbling blocks? Of course. But who would have thought this is where we would be 6 months ago? So hats off to the president. Even the left has to agree with this, that the president's made strides that other presidents have not been able to make. That is a great thing for the United States, a great thing for the world.
All right, Senator. Thank you so much for taking the time to call into Breitbart News Sunday.
Hey, thanks for having me.
All right. Again, folks, that was Senator Bill Cassidy from the great state of Louisiana.